Hello everyone, welcome to iCare Optum. So today I'm going to discuss about how fluoresceins are working. Fluorescein is an organic component used as a dye, particularly as a fluorescein agent in diagnostic procedures. Basically, this fluorescein sodium dissolves readily in aqueous alkaline solution, responds to 465 to 490 nanometer at cobalt fluo filter, and its fluorescence at 520 to 530 nanometer as a bright green. When using fluoresceins to stain cells, its charged ends to become attracted to the hydrophobic ends in the cell membrane to form a strong electrostatic bond. One or more of the charged ends of fluorescein may then become modified for a greater interaction. It is used in applanation tonometry, corneal staining, dry eye evaluation, contact lens fitting, angioscopy or angiography in retina or iris vasculature. In applanation tonometry, after a local anesthesia, a fluorescein will be applied to the eyes. Tonometer is placed on the cornea to determine the intraocular pressure. Applanation tonometry utilizes the fluorescence to produce semicircles that will give us a measurement of dial reading. Angioscopy or angiography of retina and iris vasculature for improved detection of any breaks in the vascular or associated retinal condition. Fluorescein angiography stains the blood vessels of retina and iris to provide a detailed imaging of the posterior part of eye. Researchers are saying that retinopathy of prematurity relies on fluorescein angiography to evaluate a treatment efficacy between two drugs on peripheral retinal vasculature. Unlike plain photographs, fluorescein angiography will give us a pinpoint measures in cases of vascular loop, blunting, dilatation, and capillary dropouts. And also it is used in corneal staining. This fluorescein produces remarkable contrast to determine if any corneal aberration, epithelial keratitis, herpes simplex keratitis, and in cases of corneal foreign body identification. And also it is used in dry eye evaluation. Fluorescein was useful in measuring the stability of tear film. Specifically, while measuring tear breakup time in dry eye, this fluorescein will give us a more accurate identification of breaks. And also it is used in bioimaging. Fluorescein can serve as a contrast agent in surgical procedures for non-specific identification of anatomic arrangements. And it will give us a considerable insight into the identification of non-diseased tissues, tumor-affected tissues, or histological markers. Researchers were saying the identification of structure on a deeper, fine level expands the non-specific functionality of fluorescein, and it eases the process of diagnostic procedures. In range of use can be form of bundle of nerves to the individual blood vessel, further to tissue abnormality, and even further to molecular level. Fluorescein microscopy allows for the identification of microorganisms or cellular components such as protein in immunohistological staining. Not only in eye, in cardiology study also it is used to monitor and detect in cases of coronary artery disease. Application of this fluorescein stain: paper strip with one tip stain with fluorescein. The paper strip is moistened with saline water, then placed on the conjunctiva or inferior fornix. After few blinks, this dye will spread across the eye. For ocular foreign body removal, local anesthesia will be used before staining. This fluorescein can be applied through direct on the eye or intravenous route, or it can be applied orally. In intravenous injection of fluorescent sodium occurs at the antecubital vein. The dye appears almost immediately in the retina and choroid vessels within 7 to 14 seconds. Fluorescent solution orally, it will take 10 to 15 minutes to reach, and it will be little difficult because it will be in bitter in taste. Adverse effect of this fluorescein: it will give us a severe nausea, vomiting, Abdominal pain, chest pain. Commonly, if it is given orally, it will give paresthesia of lips and changes in taste. In ophthalmic use, it will give severe eye stinging and irritation. In mild cases, urine discoloration, skin inflammation, discoloration at injection site. In moderate cases, it will give rashes, dizziness, hypotension, angioedema and chest pain. In severe cases, nerve palsy, seizure, pulmonary edema, epithelial keratopathy. Corneal opacification can occur with prolonged use. Contraindication of this fluorescein stain: hypersensitivity to fluorescein and pregnancy, lactating mother. Monitoring after fluorescein administration: usually fluorescein completely clear through the urine excision within 2 to 3 days. So there are no recommended routine testing or lab values.
Click, clap, pull it.